Polycystic ovary syndrome, or PCOS, is the most common hormonal disorder in reproductive-age women worldwide. This hormonal disorder occurs when the ovaries produce too much of the male sex hormone called androgen. In most cases of PCOS, the ovaries develop multiple small cysts and cannot release eggs regularly. Long-term complications in someone with PCOS can be avoided if diagnosed and treated early on.
The cause for PCOS is unknown. Scientists, though, have found some things that are related to it, some genetic factors, which could be possible high androgen levels. So, patients with PCOS usually have high androgen levels, but it's not certain if it's caused by it or it's just a symptom of it. So, this is a male hormone, and high levels of this male hormone can prevent the eggs from being released from the ovaries, which causes irregular periods, which can also cause infertility as well as small cysts on the ovaries because of the lack of ovulation. Another genetic factor could be insulin levels being too high. So many women with PCOS have insulin resistance, which results in higher insulin blood levels than normal. And then the high insulin, like I said, could be a cause or it could just be a symptom of PCOS. And it could also lead to type 2 diabetes later on.
As mentioned earlier, there is no direct cause of PCOS. However, if a woman has abnormal levels of androgen production, it can cause irregular ovulation as well as halting ovulation as a whole. In PCOS, the ovaries that contain ovarian follicles are immature due to hormone levels being off. This can cause ovarian follicles to become immature and stop the production of egg cells released during ovulation. GnRH, a hormone produced in the hypothalamus gland within the endocrine system, allows for the secretion of LH and FSH, which is produced in the pituitary gland. In PCOS, when there is an oversecretion of GnRH, it can cause FSH and LH levels to become abnormal, and the follicles cannot allow for growing of egg cells, similar to abnormalities in androgen production. Cysts then can form due to failed ovulation attempts, and in PCOS, the corpus luteum cannot be created because of the abnormal androgen levels. This is shown within the picture below.
Polycystic ovary syndrome affects an individual in many ways and results in multiple symptoms. One common symptom is menstrual irregularity. Due to the high androgen levels in their ovaries, the individual experiences altered gonadotropin levels or disrupted gonadotropin release, resulting in an irregular and unpredictable menstrual cycle. This irregularity differs from person to person, as some individuals have less than 9 periods per year, while others have none at all. Individuals with PCOS can experience infertility due to chronic anovulation, which is a lack of ovulation. If an individual with PCOS does get pregnant, they have a higher risk of miscarriage than individuals without PCOS. Anovulation also causes the characteristic multiple cysts within the ovaries of PCOS patients. In rare cases, a large number of cysts can cause the ovaries to become enlarged as well. A high level of androgens, such as testosterone, can lead to many other symptoms. Such symptoms include acne and oily skin, excessive terminal hair growth around the face, upper lip, chin, neck, and lower abdomen, known as hirsutism, and hair loss or hair thinning, known as alopecia, particularly male pattern baldness. In severe cases of PCOS, very high levels of androgens can cause increased masculinization, or hypothacosis. This can include increased muscle mass or deepening of the voice. Acanthosis nigricans is a condition associated with PCOS. It is a condition involving thick, velvety patches of darkened skin around the armpits, back, and sides of the neck, abdomen, and lips. This occurs due to insulin resistance, which does occur with PCOS patients. Another associated condition is obesity, as there is an increased prevalence of obesity in PCOS patients. Roughly half of PCOS patients are clinically obese or have excess abdominal obesity. As an associated condition, it can cause PCOS, but can also occur as the result of PCOS. Other associated conditions that are prevalent in PCOS patients include metabolic syndrome, type 2 diabetes, and glucose intolerance, as well as obstructive sleep apnea. Although there is no cure for PCOS, there are forms of treatment available to help reduce the symptoms and prevent further health problems in patients with PCOS. Treatment can depend on if an individual is looking to become pregnant. If this is the case, they can take medications to help stimulate egg release from the ovaries. Such medications have certain risks, such as an increased chance of twins or multiples, as well as ovarian hyperstimulation, which can cause abdominal bloating and pelvic pain. Examples of ovulation-stimulating medications include clomiphene and letrozole. Other options also include a change in diet and activity. A healthy diet and physical activity can help an individual lose weight, help their body use insulin more efficiently, lower blood glucose levels, and can sometimes stimulate ovulation. If an individual with PCOS is not looking to become pregnant, they can look into treatment options like birth control. Birth control can help control their menstrual cycles, lower androgen levels, and reduce acne. Diabetes medication like metformin is also common in PCOS patients, as it lowers insulin resistance and can help reduce androgen levels, lower blood glucose levels, and can sometimes help them ovulate. Symptom-specific medications, such as ones that target hair loss or acne, are also commonly used. Eflornithine, for example, is taken to reduce facial hair growth in PCOS patients.
As mentioned before, there is still not a known reason as to what causes PCOS, but there are a few risk factors involved that can increase the chances of someone having the condition. One of the main risk factors of PCOS is genetics. If someone has a close relative that has the condition, it greatly increases the chances of them having it as well. The next risk factor is obesity. Being obese can increase the risk of PCOS, especially if one becomes obese before they go through puberty. Another risk factor is early onset menarche. Menarche is the first menstrual cycle in females. Although girls experience their first menstrual cycle at various ages, it is considered a risk factor of PCOS if this happens at an abnormally young age. Lastly, if a girl was considered larger than average or smaller than average at birth, this could also be a risk factor of PCOS.
There is no test to definitively diagnose polycystic ovary syndrome, but there are several exams and testings that doctors will put a patient through to see if they are at risk for the condition. Doctors will start with a verbal examination by asking the patient about their medical history, including menstrual periods and weight changes, as well as family history. Afterwards, doctors will conduct a physical examination of the pelvic region. Through physical examination, doctors are visually looking for signs of excess hair growth, insulin resistance, and acne. Through physical examination, they inspect the reproductive organs for masses, growths, and other abnormalities. Doctors may conduct a blood test to analyze hormone levels in the patient, and this test can be used to exclude possible abnormalities that mimic PCOS. The third type of testing is an ultrasound, where doctors will place a wand-like device called a transducer in the vagina to check the appearance of the ovaries and thickness of the lining of the uterus. The transducer makes this possible by emitting sound waves that are converted into images on a computer screen. If someone is diagnosed with PCOS, doctors may recommend additional testing, such as periodic checks for blood pressure, glucose tolerance and cholesterol, and triglyceride levels, screening for depression and anxiety, and screening for obstructive sleep apnea.
Women with PCOS have more chance of developing certain things that other people could have less of a chance developing. This is because of the side effects, like the different hormone levels I mentioned earlier, and the causes. So things that could end up happening with age could be type 2 diabetes because of the high insulin levels, high blood pressure, heart problems because of the high blood pressure, uterine cancer, fertility issues because of lack of ovulation, And on the right, we can see kind of a visual of the prognosis. So in parental slash childhood, you could have like problems with the fetus. In adolescence, you could have menstrual problems, acne problems, just hormonal issues. When you're older and want to reproduce, you could have miscarriages, have trouble getting pregnant, have complications in your pregnancy. And then after menopause, things like type 2 diabetes, obesity, insulin resistance, etc. And then overall, we have an increased mortality from cardiovascular disease, so that could be a more fatal issue.